Hello, I'm Dr. Mary Kula, and I'm here for the series Practice Essentials. I'm here today with Dr. Teresa Wanczyk, and we're going to be talking a little bit about what is osteopathy. So Dr. Wanczyk is a medical physician myself. I have an MD. Explain to me, what exactly is osteopathy?
Well, osteopathy actually is a philosophy as well as a practice of medicine. An osteopathic physician is one who treats the whole body, the whole mind and the whole person, body, mind, and spirit. But we have a philosophy that there is four principles. There is the body is a structure and functions as a unit. The parts are interrelated, and so there's a functionality about it. And all of these parts are interrelated, and we actually expect that the body will maintain its health through through its own ability to maintain its health. Okay, so we believe that the body can heal itself. All right. How do we differ between from the MD? Well, we get a lot more training in anatomy. We have anatomy lab in our first 2 years, and we also, the schools today also start teaching hands-on manipulative treatment. An osteopathic physician, as the founder, Andrew Taylor Still, did in 1874, he used his hands to heal. How did he do that? He himself, the founder of osteopathy, Andrew Taylor Still, was a physician at the time of the Civil War. He learned by apprenticeship from a medical school, but then by apprenticeship he learned his trade. And he had an opportunity during the war to do a lot of, his interest was dissection, and he did a lot of anatomical study, both animals and Indians apparently. He gained a superb knowledge of anatomy, and he felt that there was a interrelated function between the anatomy and the structure, and that when this structure was perfectly balanced, the body would have everything in it that it needed to heal itself. So that was kind of what attracted me to osteopathy. Well, not just that the body can heal itself, but that you would use your hands to be of service and to help people. And I tend to be the kind of person who likes to do that. I like to touch and find out for myself what it feels like. And that way I'm able to help the person that I'm taking care of. How do we differ? You asked, how does the osteopath differ from the MD?
Right.
There's the anatomy training, and there's the anatomy laboratories, with the manipulative treatment laboratories that we attend. And for the first 2 years, the students actually practice on each other. There's one lab a week where the entire class, and at our school, at the Chicago College of Osteopathic Medicine, now called Midwestern University, the entire class of 208 people or so assembles there and receives a lecture and then does hands-on practice. And so by the time we're in our senior year, we've actually practiced quite a bit with each other, and had an opportunity to at least get the principles down of how the structure and the function are interrelated. In the meantime, we're studying all of the anatomy and physiology and biochemistry to make us a full-fledged physician capable of prescribing medications. That's different than the chiropractor who learns anatomy, physiology. They study, of course, like we do, radiology, but they are not studying the physiology, or they're not studying the pharmacology so that they're able to prescribe pharmaceuticals. So that is the key difference. A lot of people in my practice, as I was coming to this point in time, would come to me rather than a chiropractor, because I could also prescribe medications for them that they needed to manage their pain.
So if I'm hearing correctly, there's a couple differences. First of all, osteopathy, there's a theory behind it, that the body has the ability to heal itself.
Yes.
So that's the first thing. Secondly, it's different in some ways from a medical physician, because there's some hands-on manipulations that as an MD we don't usually do.
Right.
And it differs from chiropractic because you can prescribe medications like an MD.
Correct.
Okay. What exactly are these manipulations or these techniques that you use with your hands?
Okay, there are probably about 10 different techniques. They have different names. What they are we study the spine, and we study we palpate the spine. We feel how each segment moves, and we do a lot of motion testing. We do a structural examination. We have a person stand up. It's part of what I do, is to have them stand up and look at their structure to see how it moves, how it stands in space, and then how it moves on the table. How I might move a joint to see if it's working properly. And I get a feel for whether there's been some trauma there. And one of the techniques that I love to use the most is called a myofascial release. And I might put the body into a position where the body actually starts to unwind and release the pent-up energy that is there. And so, as a student, I had the fortune to go to a class in cranial osteopathy when I was in my second year. I was one of 3 students in the school that had this opportunity, and I learned how to be very still and to just hold, it was the head or even a part of the body, and we learned how to just listen. We learned how to listen to see what was there and see what was happening. And it actually became very interesting. There's so much going on. And what you would be able to feel was the fascia moving. You would be able to feel a rhythm in the body, and it is with that rhythm that we join and do not obstruct. And when we join it, we actually enhance it because our energy actually joins with the energy. Okay, so is it an energy treatment? I never thought of it like that until one of my patients came to me and said, "Are you doing energy medicine?" And I said, "Oh, I don't think so. I'm doing osteopathy." But in fact, what we do is by contact, many things actually happen. There's myofascial release. There's a typical high velocity treatment where you learn the segments of the body, and you learn exactly how they're stuck, and you try to unstick them by putting them into a proper position and giving a little extra push, or just it will actually go on its own is what really happens. You don't have to particularly apply force. But there are some treatments that do require a force and can manage a force. We don't use them very often because it's very difficult to properly put the body in the right position and give the right amount of force. While it does come with experience, the old-timers can actually make the spine all freely movable.
And that's why it's so important to go with someone with experience like you have, since you've been practicing since, I believe, 1986.
Yes, that's correct.
That's fantastic.
Yeah.
We thank you so much for coming today and for being part of this series. And
thank you.
Thank you very much for sharing with us. Appreciate it.
That's quick.